So this is what he said. No plans to remove care workers from the shortage occupation list, Downstreet said. I am not the one that is saying this. The UK Prime Minister Rishi Sunak, he said this. So the reason why I am making this video is because some of you have been commenting in my previous videos saying UK is a scam. So we're going to be addressing this healthcare job with visa sponsorship, especially for those of you planning to come to the UK on a healthcare visa. I believe this video is going to make you understand what is happening.
You've been living your good life, catch a glimpse from the outside, then you see me now, see me now, see now.
Hi beautiful people, welcome back again to my YouTube channel. If today is your first time here, my name is Stella. If you have not subscribed to my channel, what are you waiting for? Please do not forget to like, subscribe and share my videos. Click on that notification bell to get notified whenever I post any new video. And for my returning subscribers, you guys are the real G. Thank you guys for the love, for the support. Honestly, I really do appreciate. So on this channel, I'll talk about my life here in the UK, what is happening around me, and I share information. So if this sounds like what you're going to be interested in, then do not forget again to do the needful. Like, subscribe and share. So in today's video, I'll be discussing this announcement, or should I say this statement made by the UK Prime Minister. So there have been lots of up and down, even from my subscribers. I saw some of your comments, and that is one of the reasons why I'm making today's video. In my previous video where I talked about let me go to my YouTube channel so that I will even know what I'm saying, honestly. Okay. Where I made a post on proposal on healthcare worker visa. In that video, I was talking about the latest proposal where the nursing bosses were saying they should scrap down the health and care visa increase because it's going to discourage so many nurses and healthcare workers from coming to the UK to work. And in that video, I was able to see some few comments. Sometimes I will see like 10-15 comments. Well, when I go through it, I won't see the comments you get, but I was able to see few comments. And if I don't reply to your comments, I'm so sorry. Sometimes when I just post my video, I just keep the phone or keep my laptop. I don't go through it again. And obviously, I'm a mom. I also work. I've got kids, and honestly, with children in this UK, they are full-time work. So sometimes I don't go to my phone to start commenting or to start replying to comment, but sometimes I reply, especially at night, maybe when everybody's sleeping. When I go through my phone, I start replying some comments. But the main reason why I'm making this video is because of this announcement Rishi Sunak made, and that he has no plans of removing healthcare worker from the shortage occupation list. And there's so many rumors like, oh, they will soon remove healthcare job from visa sponsorship, they will soon do that. And to me personally, I feel it's possible that they won't be removing this healthcare job with visa sponsorship anytime soon. Yes, that's what I feel. Some of you will agree with me, especially people already in the UK will agree with me that this healthcare job, people that cover up all of this shit in my previous video, which I mentioned, are mostly international students. Yes. So the healthcare job, warehouse job, cleaning jobs, and which other jobs that will I say is so easy to get. I mean, at the end of the day, we have got bills to pay. So some persons start off from this job, and after working as a carer or as a cleaner or warehouse, after some few months they will get that better job or their dream job they want to. I mean, even if you don't get your dream job or that type of job you want, you can still be applying while you're still on this healthcare job. Do you get? So now, why am I saying all of this? That is because of this statement Rishi Sunak made. And aside from it, someone on my comment section said this. So now I want to read this comment from No One Z. This person dropped a comment in my previous video where I talk about that scrapping of health and care worker visa fee, the increase. I mean, they say there are a lot of vacancies. They need more people in care sector, like 150k plus. But many people are not getting jobs. How does that work? But those that are already didn't even, anyway, I think what this person is trying to say, but those that are already in the UK are not getting any jobs. How does it work? This is a scam by the UK government. I didn't see any vacancies as there are already enough people in the UK. So now, I'll agree with this person that there are some persons that are already in the UK and they are not getting enough shifts. I'll agree with you. But at the same time, you also made a comment that you've been searching and I don't know if you are searching or not, to be honest, but from your comments you're like, I didn't see any job vacancies. But I want you to understand something, that UK is very big. So now I don't know where you're searching from. But one thing I will let you know, that those persons that are already in the UK that are not getting enough jobs, make your research, ask questions. You will realize that these persons are working for agencies. So now if you're working for agency, sometimes agency will, they will recruit, or should I say sponsor, more than they have. If a care home or NHS hospital sponsor you, there is no way you tell me you're not getting any shift, honestly. Like, there's no way NHS hospital or NHS trust anywhere in the UK will sponsor you and you tell me you're not getting any shift. You will walk and tell yourself, what kind of work is this? Because I know some persons that are already working for the NHS that are looking for private sectors to start working with because they are so stressed. I am still seeing some person working in a care home that are working from Monday to Friday, Monday to Monday, and I'll be asking them even after tax, why are you working every single day? There are still some persons like that. Do you get? But these persons that are not getting shifts, is true, which I will agree with you. I feel like most people that I've seen complain they're not getting enough shifts are those people that agency recruits. And sometimes this agency are just being greedy because, honestly, believe it or not, most of the time this agency collects money to sponsor you here in the UK, to give you the COS. So it's like business for them. So they don't even have enough connection, they don't have enough care homes to send you to, and they are collecting all of that money. After you enter the country, you'll be stranded. So honestly speaking, if you get a job with the NHS trust, there's nothing like I am not getting a shift. Even if you get in a care home, there's no such things. There's no such thing. So this is how it works. To be honest, UK is very big, and like I said, the UK Prime Minister just said that he has no plans to remove it, because if you remove it, who is going to do this job? When students, I don't know, except they change the law or they change the rule by next year, because there's not much students coming in this year, which I'm not sure they will be coming in next year. Somehow they have controlled the crowd, or they have controlled the rush. You get? They've controlled it because there's no rush this year. So I don't know what will happen next year. So probably by next year they might still change the rule. So this is what the Prime Minister said. So why am I saying this? Is because of you saying that those people already in the UK are not getting enough shift. So that is why I'm trying to clarify this. Anybody that is in the UK that is not getting enough shift, ask this person. You realize that the person was sponsored by an agency. If a care home or NHS trust sponsor you, there's no way you will tell me you're not getting shift. You will walk and run. Yes, I am telling you this. And some persons were telling me that, okay, how would they sponsor you? How would they do this and that? Okay, now I'll tell you from the few persons I've met here in the UK, and someone I've met at the NHS open day. This person said when she got the job as healthcare worker, I think she was on band 2, I don't know, but I think she did a training in that same NHS and she upgraded, and that was when they sponsored her. And now when she applied for the job, she didn't say anything like she was looking for sponsorship, but deep down she wanted sponsorship. And luckily for her, after the few MVQ training and all of that, they sponsor her. I think, honestly, I don't know the trust. I don't know if it's in Bradford or Wakefield, but she said that they wanted band 3, and after some training that she did, she was able to get the band 3 and she was sponsored. So sometimes it depends on the band. Some person will be like, you must be from band 2. I remember when I went for that NHS open day, they said before you can even apply for any NHS job, you must have MVQ level 2. It was even written boldly there, you must have MVQ level 2. NHS always said that. So let's say now you're applying for NHS job with visa sponsorship and you don't even have any MVQ. All you have is your care certificate. My sister, my brother, how do you think that will work? Do you understand? So you need to have at least MVQ level 2 to even start with. So that is by the way. So this is what Rishi Sunak said. The government has no plans to remove care workers from the shortage occupation list to cut immigration despite calls from the Tory MPs, Downstreet said. Number 10 also downplayed the prospect of blocking foreign university students from staying in the UK after graduation, another recommendation made by the new Conservative group. The 25-strong caucus of right-wing Tory MPs from the 2017 and 2019 intake are calling on ministers to close temporary visa scheme for care workers and cap the number of refugee settlements in the UK at 20,000. Among those backing the recommendation is Tory Deputy Chairman Lee Adamson and the backbencher Marian Cates. So he went further saying, asked whether care workers will be removed from the shortage occupation list. The official replied, that is not an approach we are considering currently. Again, we know there is sufficient demand in care sector for staff. Okay. on whether the government will remove the ability of overseas students to stay in the Britain for a certain time after their degree has finished. He said, "I'm not aware of any plans to go that far." Obviously, I think people will recognize that highly trained students with the skill the UK wants and needs are people we should welcome. Downstreet did not rule out a 20,000 limit on refugee resettlement, as it is reported recommended, but suggested any cap will be for Parliament to make a judgment on, rather than for the government to set unilaterally. So what am I trying to say? The UK government has no plans to remove the healthcare job with visa sponsorship from the shortage occupation list. So from what is happening, there's so many ups and downs, and some of the prime minister agree that they have got enough staff that will fill in this sector. I mean, like, they've got enough people to cover up these sectors. But at the same time, there are so many persons opposing it, saying they need more people from the overseas. So you can see it's just two debates. But the UK Prime Minister said he has no plans to remove the healthcare worker visa from the shortage occupation. Mind you, as soon as they remove the code, there will not be anything like healthcare job with visa sponsorship. So as long as the code is still there, they will still be recruiting from overseas. And this agency that don't even have enough shifts will still be recruiting from overseas, still collecting people's money, because me personally, I see this agency work as business. But if you're already in the UK and you have a car, when I mean you have a car, you have your own car that you're driving, there are some agency that will sponsor you without you paying a dime. I already know some in my location. You must have a car, you must have the necessary trainings, but you must have your own personal car. And this job is domiciliary job. This job is domiciliary job, the one you go house by house. In the past, sometimes I used to recommend some, care agency for some person. But at the time when some person start, complaining about this dorm, they'll be like, oh my God, this domiciliary job is so stressful. I'll leave my house around 8 o'clock, come back 10 o'clock, and they'll pay me for 8 hours, I'll be 9 hours. Because honestly, I don't know how the hours work for this domiciliary work. What I do is I do support, which when I get to my place of work, when I start 8 o'clock, I finish 8 o'clock, it's 12 hours I get paid for. So some persons doing this domiciliary care job are complaining that their hours are always cut down, which me personally, I don't know why. Is it because they are driving on the road that they don't get paid for? So I just stop, recommending this dumb job for people, because me, I'm tired of explaining, because you go explain tire. I am tired of explaining. I've never even done this domiciliary care job. So at the time, I just stopped recommending, some care agencies that are recruiting because of too much complaints. So anyways, if you're planning to come to the UK on this health and care worker visa, just know that you still have hope of coming. That's if UK is your number one choice of place to live or place to relocate. Just know that there's still hope on this health and care worker visa. And if you're planning to come, also try in NHS job. And aside from this health and care worker visa, there are other, opportunities you can also consider. Don't just stick to this healthcare job, because there's so many job opportunities you can see online that even you yourself can apply. Like if you have done few trainings and you think you've got the skills, you can also go for this job, not necessarily the healthcare job. You understand? This care job is not even for everybody, honestly speaking. So many things have been going on in this healthcare thing. I know that you learn on the job, the more you do the job, the more you get used to everything around you. But at the same time, if you're not getting this healthcare job with visa sponsorship, also try other type of job that you can also do with the latest certificate you've got. Or better still, consider other countries like Canada, US, Australia, just other countries, other European countries that are also recruiting this healthcare job with visa sponsorship. It's worth trying, to be honest. Well, I just want to clarify this updates on health and care worker visa, because for me personally, whether it's scam or it's not scam, they cannot recruit every single person. That is just it. Some persons will get the job, some persons will not get the job. So saying it's a scam or no scam, if you already know UK, you know that every single day they change rules. If you're someone that follow updates like what's happening in the UK, you know that UK, all they do is everything in their own favor. All they care about is the British people. They don't care about nobody else. If they care about you, it's your money. That is just the truth. Or the service you can, render to their country, or should I say to their economy. That is just the truth. To be honest, if you're still hoping to get healthcare job with visa sponsorship in the UK, just know that there's still possibility that you will still get this job as long as it's still in the shortage occupation list. Well, that is it for today's video. If you find this video interesting and informative to watch, do not forget to do the needful. Like, subscribe, and share my videos. I'll see you guys in my next video. Bye guys.